Okay. Thank you all so much for joining us for today's Kidney Connections webinar. We're just really grateful that you're here, and we're so excited for today's topic, especially as we enter World Kidney Month and World Kidney Day. So our mission at the National Kidney Foundation of Illinois, and I should probably introduce myself before I get into that. So I'm Rachel DePaul. I'm the Vice President of Programs for the NKFI. And our mission is to improve the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. And I'd just like to quickly thank our sponsors, Fresenius Kidney Care, UI Health, and Northwestern Medicine. And we also ask you all just to save the date because our next session will be Thursday, May 15th. We'll have a webinar where we'll talk about lupus and kidney disease. Saturday, September 13th, we'll be in person again at the Marriott Chicago Medical District, and we'll have some really great panel discussions. And then Thursday, November 13th, we'll be talking about nutrition and kidney disease. And with that, I'll also remind everybody just to follow us on our socials and to check out our podcast, The Journey Continues. I think every single one of our panelists today has been on The Journey Continues. So please make sure to listen and hear their stories too. And now I'm so pleased to introduce our facilitator for today, Anita Phillip, who is an advanced practice registered nurse. And I'm just going to turn it over to you, Anita. Thank you all so much.
Thank you, everyone. Thank you, Rachel, for that introduction. I am so happy to be able to participate and to be able to lead this webinar. Welcome to Kidney Connections, everyone. And I would like to thank our panelists who will be participating in this webinar today. And they have decided to share their experiences and their journey of kidney disease, and hopefully that whoever will be able to participate will also be able to learn from this, and we'll go from there. I would like to introduce the panelists today. First, we have Leah Howell. And then we have Nadia Payne, and then we have
I was coming home and needed and I was in a relatively rural area, and so I moved back to, I'm originally from Detroit, and karaoke because I was trying my best to live life to the fullest at that point. At that time we didn't have cell phones. I had a pager, so I got a page from the hospital. I called them back. They said, we have a match. It was a 6-point match. I went in, I got my transplant, and left the hospital 5 days post-op with everything looking beautifully. And 7 days post-op, I developed a clot in my renal artery, immediately returned to the hospital, and unfortunately, that graft was no longer successful. So I returned back to dialysis for another 13 months. And 13 months later, on my birthday, while I was laying in bed dialyzing, watching Law and Order, I got the second call. And that is when Joey came into my life, my transplanted kidney. He was actually transplanted the day after my birthday. So we have a running joke that I celebrate a birth month, and nobody will give me a better gift than my transplant surgeon. But this year, I'll celebrate 21 years. And I know we'll talk a lot about different things throughout our time today. But I think the last thing that I would leave you with is I am incredibly blessed. I am incredibly fortunate. I know that, and I celebrate that every day. But transplant is a treatment, it's not a cure. And so doing everything you can to, reduce your risk and change the trajectory early, and then as you have the disease, and then if you do get to transplant, also really being mindful of health and wellness and all of that is critically important. And I'm sitting here today because I had some really great people around me who helped me to really steer some of those decisions from a health standpoint and a wellness standpoint. So it's a pleasure to be here, and I look forward to continuing the conversation.
Thank you, Leah, so much. We will be asking more questions throughout the meeting or the webinar, but I just have a quick question. From the time that you've had the infection till you have gone to be on dialysis, what were your symptoms? Like, how has your symptoms progressed over the years? Can you explain that, please?
Yeah, so from the time I had the initial infections, which again were in middle school, I didn't have a lot of external symptoms. In fact, I often didn't know that I had an infection until I was so sick I needed to be hospitalized, and I had, larger than just a typical UTI or kidney infection feeling. The symptoms for me, in terms of recognizing that I actually had more than just chronic pyelonephritis and truly had kidney disease and kidney failure, I started to gain a lot of weight. I started to carry a lot of water weight, particularly in my extremities. And then I also started to really have difficulty maintaining and keeping food down. And then last, I had really, really severe migraines, likely because of all the toxins in my system. But those were the things that for me, and they didn't show up until I think if I do the math, somewhere in the neighborhood of like 15 years after my initial infections. So it was definitely a bit of a surprise at that point. And I have they like to joke I've been a person who hasn't had a lot of the traditional symptoms along the way, which is my reminder to pay attention to all of the things in your body.
Yeah. My other question is, were you following up with a physician during this time to ensure that your kidney disease was being managed and that it wasn't progressing? So
Yeah, that's a
can you
great
share
question.
a little bit about that?
Yeah. Unfortunately, I was not. Again, in seventh grade, we thought it was a one-time infection. I had another infection about a year later in eighth grade. And then from there, between a combination of just not really having symptoms or having any infections going on, not having access to insurance or healthcare, for me and my sort of home and socioeconomic status, and then moving from one major area to another area in the middle of high school, I was not following with anybody. And so, I wonder sometimes if that would have changed things. And when you have that opportunity to have access, I think access to healthcare is huge. But unfortunately, because of my circumstances, I was not.
Thank you. Thank you for sharing that. And I think I understand there's a lot of social issues that can also impact someone from not seeking the care that they really need. And it looks like that was one of your challenges that you faced. But for someone that who would like to that who do have kidney disease, what is your recommendation or suggestion that they should do to prevent the progression of the disease so that there are no surprises at the end when they do need to reach dialysis?
Um, I think find your circle of support, and that means first and foremost finding a provider who is your ally, your champion, who is in your corner, who listens to you, and stick with them. I think having that caregiver, having that provider, whether it be a primary care physician who is sort of your acting, I like to say, sort of your acting quarterback, who's helping to run things for you, whether it be the nephrologist, but you need somebody in your corner to consistently help advocate for you and with you, and to ask all of those important questions. And if you don't get a response from somebody, or you don't have the right fit with the provider you're with, keep asking, keep kicking, keep looking for the one that is going to be your ally and your champion, because they are out there.
Thank you, Leah, so much. I'm sure we'll be coming back to you again. I would like to hand over to Miss Nadia at this time. Nadia, thank you so much for joining us, and thank you, Leah. We will be coming back to you. Would you be able to share your experience of your kidney disease with our audience, please? And thank you so much for your time.
Yes, thank you very much for having me. Um, my name is Nadia, and I have stage three kidney disease. I, excuse me, I've had stage three kidney disease since 2014 when I was diagnosed with it. I also have type 2 diabetes. So, as a type 2 diabetic, they do a series of blood tests, which is called a comprehensive metabolic panel. In that blood test, they run a test called a creatinine test, which tests the level of your kidney function. And when they ran that creatinine test, my creatinine level was very high. And when they did that, they thought it was the diabetic medication that I was taking. So they took me off the diabetic medication. And 3 months later, when they did my comprehensive metabolic panel again, my creatinine level was still high. So my doctor asked me, what medications are you taking? I was taking ibuprofen at the time for my migraines, and he said, what? And he asked me how many milligrams of my ibuprofen was I taking. And I told him at the time I was taking 800 because that's the amount needed to cure my migraines. And that's when he almost hit the floor. He literally asked me to stop taking the migraine medication, and one of the diabetic medications that I was taking, I had to stop. Um, it was found that the ibuprofen that I was taking had damaged my kidneys, and caused the elevated creatinine level in my elevated creatinine levels. I was taking a maximum of 2,400 milligrams of ibuprofen to cure my migraines, and the doctor said that the ibuprofen alone had caused the damage to my kidneys. So he immediately assigned me to a nephrologist. The nephrologist, I was at the time, I was 37 years old, and he said I was his youngest patient that he had because all of his patients that he had were much older than I was. And he was shocked to see that I had kidney disease. And he said that his main goal was to keep me from being a stage 4 or renal failure or transplant patient. That was in 2014. So every year, he said I would only have to see him twice a year if I maintained good kidney health. So that means I would see him in June of each year and in December of each year to have my labs run, which was the same comprehensive metabolic panel to test my creatinine level, test my potassium level, to test my oxygen, all the labs I needed to test the kidney function that I have. And each year, each time of the year, every June, maybe December, we would celebrate that I was still stage 3 kidney disease. So it'll be 12 years in August that I have still stage 3 kidney disease. And as of February 1st of this year, it's 3 years that I've been off of insulin. Um, it's been a journey. People say, oh, it's easy. It's hard to be a kidney disease patient. And it's not hard when you want to save your life. There was a point that I had to take Lasix to reduce the amount of fluid that was on my kidney because my kidneys could not pull the fluid itself. He has since taken me off the Lasix because my body can pull its own fluid off by itself. There was only one time I had to go back on it, but ever since then I have not had to do it anymore. So there's things I have to watch. I have to watch my sodium. I have to watch. I can't have pop or I can't have soda, things like of that nature. But when you think about your kidney health and thinking about the functioning of it and what it does, how it removes the toxins from your system, when you think about what it does to save your life, and when I think about the people who have to be on dialysis and have to pass the dialysis system, he used to be in a dialysis office. So I have to pass those people all the time to go to see him. And it just made me think even more, I don't want to be there. So since I didn't want to be there, it made me want to encourage me more to follow my plan.
Thank you so much. Couple of things that I noted. First of all, congratulations for being on that stage 3 for many, many years. And that shows that you really care about your kidneys and your health because it does take a lot of work and energy from your end. And I really congratulate you for that. But I would like you to share with the audience what are some of the strategies or the recommendations of making sure that your kidney disease doesn't progress, and how did you stay in that stage 3 for so many years?
Well, one of the things I'm very proactive about is the medications that I'm provided. So when a doctor prescribes me a medication, the very first question I ask is, how does it affect my kidneys? So I don't automatically fill a prescription. If the doctor is unable to tell me how it affects me, even if he tells me it won't affect my kidneys, I still come home and use all of my Google resources. I'm a big fan of WebMD. So I will take the medication to WebMD, I look it up, and if I see that in any way it says affects the kidneys or causes kidney problems or I will call the doctor, I will call the pharmacist, and normally I'll call the Walgreens pharmacist and say, this says it causes affects kidney function. And they'll usually tell me only if you're a dialysis patient or only if you're in this stage of kidney disease. Because what happens is if you're in a stage 4 kidney disease or at renal failure, that's what that medication means when it says may affect the kidneys. But if you're in stage 3, you're in a little safer position. So you can take that medication. And sometimes when doctors tell you that, they don't explain that to you. So your pharmacist is your best ally. Doctors don't always have time to explain things like that to you. So the pharmacist is your best ally. But also doing your own research. You don't have to fill a prescription as soon as you get it. You don't have to take it as soon as you get it. Research and find on your own. Cooking at home. Very rarely do I eat out. It has to be a special occasion. Making my own food because I know what goes in it. I have to watch my phosphorus intake. Food that is prepackaged, cooked outside, it has so much phosphorus that I can't control it. But I control what goes in my house. So I know how much phosphorus is going in, I know how much sodium is going in it, the kind of fat that is going in there. So I know it's healthy and it's going to go into my body.
Thank you so much. And you made a great point. A lot of times, a patient may go into the emergency room because of something else that's going on with their health. Or there may be in a lot of pain because of an accident or something that has happened. In that instance, they may get a pain prescription, that could be affecting their kidneys, right? But you did make a great point because they can certainly call the pharmacist or whoever that's there, if they're following up with the nephrologist or a kidney doctor. They can call their kidney doctor to make sure whatever that was prescribed for them, during that visit, is it okay for them to continue that medication? That communication is so important, and making sure that you advocate for your health is so important. And I think you are doing an excellent job. And that's one of the reasons why I think you are able to maintain that stage 3 kidney disease for a very long time. And I thank you for sharing that. My other question that I have for you is you did talk about some, especially about eating out, that how you're very careful about the meal that you cook and everything. But in case if someone does go out, how do you manage dining out or being in social setting while still managing a healthy diet?
Well, you can work now. I believe the country is getting better. Our country is getting better at how they do things. You can request low sodium meals. You can request dressings on the side. You can request sauces on the side. You can request reduced sodium or low salt sauces. You can request those things. A lot of people don't do these things because they don't know that they can ask for them. I like the saying that you have not because you ask not. So if you don't ask for it to be reduced sodium, or if you don't ask for it to be something on the side, then they won't know to do it. A lot of people now have a lot of allergies to certain foods. So restaurants have become more accommodating when it comes to making foods. So if they know that they need to make a certain way, then a lot of people are coming up with dietary problems as well. So if you know your dietary needs, they will make it to your dietary specification.
Thank you. Another thing that I normally get from my patients is that it takes a lot of self-control to be able to follow a healthy diet plan. Um, but if you are in that situation, what has helped to manage cravings for food that you're told to limit? What are some suggestions that you would give?
Well, I'm on a plan called WW, and we don't limit anything. It's everything in moderation. No one is supposed to have a lot of anything. So you're not supposed to eat a whole lot of anything. But I believe you can have what you want, you just do it in moderation. Everything is supposed to be done in a portion controlled manner. So just give it to yourself. You can have it, but just give it to yourself in moderation. Too much of anything is bad for anybody. So too much salt, too much sugar is bad for anyone. You don't have to be a kidney patient or a diabetic. It's just bad for you. period. But there's nothing to say that you can't. For my birthday, I had banana pudding. Oh, you're diabetic? No, I didn't say I had a whole jar of banana pudding, but I portioned out for myself enough that it did not affect my blood sugar. And it kept me in a range that was significant enough for my doctor to say, okay, I didn't even know you had banana pudding, but it was something that I enjoyed, and I was satisfied, but I still enjoyed it as a treat for my birthday. So it's not that I deprive myself of anything. I still have what I enjoy, but I do it in moderation.
I love your answer. The moderation is the key aspect of this, and absolutely, I agree with you. It's not that we are completely taking away whatever that you like. It's just like what happens if you eat this much versus this much, as recommended by your renal dietitian or your physician, and that's the key here. Thank you so much for reiterating that. My other question for you is, you talked about the stages of kidney disease, stage 3. There is a lot of confusion about stages of kidney disease, believe it or not. What does stages of kidney disease indicate? What does that mean to you?
Okay, so stage 3 means I have moderate level functioning of kidney disease. So that means my kidney disease, my disease is at a moderate level of function. It actually can be reversed. So because of my kidney disease the way it is, with weight loss, proper eating, I can be reversed back to stage 2. Stage 3B is a little bit more severe. There's 2 stages in 3. There's 3A and 3B. So 3A is where I am, which can be reversed back to stage 2, which it means your kidneys are still at a high functioning moderate rate, or almost normal. Stage 3B, which means they're not functioning as well, you're on the way to stage 4. Stage 4 means you're not that functioning that well. You're on your way to renal failure. You're not your kidneys are in bad shape. You're eating too much sodium. There's the functioning of them means that you have less fluid that you can have. You have a lot of restrictions on there for stage 4. Renal failure, you're headed to the transplant list, and then after that is transplant. So when you go through the different stages, it means the less amount of functioning kidneys, and with the less amount of functioning, the less urine you produce. Stage 4, you're headed for dialysis as well. So that's when you have to have the machine pull off the fluid of your body. We have a lot of restrictions on stage 4 as far as what you can eat, what you can drink. When I say drink, I mean everything. That includes like soups, water, tea, juice. I mean, they give you like 4 ounces. And they were telling me that when my renal dietitian went through the stages of renal failure in stage 4, I was like, I wouldn't survive. I said, because I like water. I mean, literally, I drink like almost 8 bottles of water a day. So when they talk about like 4 ounces of water, I said, I never would live on stage 4. So yeah, so it's really restrictive. The higher the stages go, the more restrictive things get, and the lower the stages are, the less restrictive things are. So the higher are, the more medications you have to take on stages 4 and higher and above. The more the things you can less the more medications you can't take because your kidneys are failing. So when they say may cause may affect your kidneys on those commercials, when you hear about the medicine that may affect your kidneys, you can't take that medicine, you can't take that medicine, you can't take that medicine. So your doctors really are limited to what they can prescribe to you.
Yeah, so stage 1, stage 2 you're on the higher end of the spectrum where
You're
the
in a higher
kidneys,
end.
yes,
Stage 3, you're still not that bad. You're
correct.
still able to get some things done. The doctors still have a leeway what they can prescribe to you. You're still able to, you're stage 3, you don't even have to see a renal dietitian. You can go see one if you'd like, just to have
Correct.
some idea of what you should
Yeah.
eat. But stage 3B, stage 4 and on up, you have to see a renal dietitian very frequently to keep up with the renal diet that they have. They can monitor you on the renal diet. You have to have a dialysis technician. I mean, there's just so much there's a lot of work between 3B and above.
Yeah, so just want to clarify stage 4 and stage 5. Stage 5 are the patients who will need dialysis pretty soon. So stage 4 is severe kidney disease. So we're
Yes.
kind of keeping a close eye on them because they are progressing pretty fast. So
Yes.
that the fact that they're progressing, that's where they need close monitoring when they get to stage 4 and
Yes.
stage 5. Thank you so much for helping us to clarify that. I know there's a lot of questions about the stages of kidney disease, so that's why I had asked. Thank you.
You're
Thank
very
you so
welcome.
much for Nadia, and I'm sure we'll be coming back to you for more questions. And thank you for sharing your personal journey, and we really appreciate your time.
You're welcome.
And next, we have Ms. Deja Bathers. Deja, thank you so much for joining us. And I am so inspired by your story. And I'm like to just have you share your personal experience.
I would love to. Hi, everybody. Thanks for joining. See some family and friends on here. So thank you for coming. My name is Deja. I was diagnosed with juvenile diabetes. I was type 1, obviously, when you're diagnosed that young. So I was diagnosed at age 4. And I want to say that my adolescent, teen, and early adulthood, I was under very good care. And that really set the trajectory for the beginning of my life. So diabetes was not an inconvenience, it's all I've ever known. And I was managed by an amazing team. But at 24, I did lose my insurance, and then I became self-managing. Luckily, I had a lot of the tools that I needed. So for a few years, I was doing relatively well. I didn't have a primary that I was seeing on a regular basis. I was seeing somebody different every appointment. Sorry about that. I was seeing somebody different every appointment. So I didn't really have my team at that time. And then I started to work, and I became reactive instead of proactive. And I think at one point for the industry that I was in, it was very fast paced. And I think I may have been more concerned about the aesthetic of me instead of the health of me. And that should have been reversed. So at that time, I did see some changes. They were subtle, and I ignored them. I did. I started to ignore them. I think I was scared of bad news, but my A1C was out of control for some time. So some of the progression was because I was caught up into all these other things like work and staying busy. And like I said, I was doing the bare minimum, if I can be honest. And by the time I was 37, it was no longer ignoring things, because once the kidneys go, the eyes go. Start finding, like noticing some signs that like, okay, it's changing. I was getting halos and floaters and things like that. Then I was like, okay, it's time to get serious. The first doctor I went to, the first set of blood work that I got done, not only was my A1C probably at 11 at that time.
Oh, wow.
It was like, it was like it happened so quickly. The next doctor, nephrologist, and he looked at me and he said, we need to talk. And then from there, it was eye surgeries. It was progressing so badly, I did go straight into peritoneal dialysis. Choice I made because my father, who was over 70 at the time, he had been doing peritoneal dialysis for about 6 years, and he was very successful on it. At that time, I finally found an endocrinologist. I got on an insulin pump. I got my glyco down to, not my glyco, my A1C down to 7. But the vision was already kind of taking course. And at that time, I needed several eye procedures, including a retina attachment. I had diabetes retinopathy. Some of those things are irreversible. There was a point where I could not see. And I was also, like I said, I was on peritoneal dialysis. I was very successful on it. And I had some talks with my nephrologist, and we knew that I was going to be listed. Once I got the workup, I don't think people understand the workup to a kidney transplant. It takes some time, with those appointments. It probably took me about 8-9 months. But I had a nurse, I won't say her name on here, but I had a nurse come to me. She pulled me to the side. Now it's more protocol, even just these last 5 months or less than a year now. But she was the one who said, Deja, you have to reverse the diabetes. If you're going to get a kidney, you should get a pancreas. And I thought that was something futuristic when I was a kid. I remember being like 13 years old, and my my diabetic doctor my endocrinologist would say, one day you'll get a kidney a pancreas transplant.
Mhm.
And I said, okay. Didn't even think that was possible. So when she encouraged me to get the pancreas, that really, really made the difference. And I'm so blessed for her telling me to do it. Best decision I had made for myself. And I was only listed for about 2 months before I got my first call.
Oh, wow. That's really awesome. Um, your story really inspired me. First of all, I saw juvenile insulin dependent diabetes. That is a very vulnerable age. And I do have couple of my friends' kids actually, they are going through that. What were some challenges you have faced? Because you were at that vulnerable age, and what were the challenges, and how did you overcome those challenges? Because I'm sure, like, you're with your peers, and you felt like, I kind of feel like I'm a little different here, right? And I'm pretty sure you've been asked some questions too by others. Like, how did you overcome all those things?
I'll start with I didn't feel different. I felt special.
Okay, very good. Okay.
That's my friends. I had a village, even down to my friends. So
Uh-huh.
I felt special. Everybody
Okay.
gave me a little bit more attention because there's this thing that we know something could happen. So people
Okay.
watching me, I think people were watching. And I was hyper aware of high and lows. Thank goodness I had a sensitivity to both. So I think it happened so early in my life. To be honest, I would more so rather answer the question of what to do now. I ask people all the time, what do normal people do?
Mm-hmm.
I lived 36 years with diabetes. I still get ready to reach for, I keep a blood kit in my car, still
Mm-hmm.
not use it. I keep it because it's comfort.
Mm-hmm.
I live my life with it. So I'm more pivoting and adjusting to not having it.
Mm-hmm.
Um, Diabetes was very much a part of me. I babied it and I nurtured it. Even when I wasn't doing good, there was still something in me that knew, like, okay, now you really need to do this or that. Like, I never completely let it go. And I never went one day without my insulin, even though the numbers didn't show that.
Okay.
But I never took my insulin. So it really was just such a part of the fabric of me.
Mm-hmm.
Never, it just felt special.
Okay. Well, thank you. I mean, I also think that you are very brave, that you were there as an example to others, and I can see that, just by looking at you, and I really appreciate that. And you're such an inspiration to others, because there are other people that may look at it in a different way, and that the fact that how you responded, how you answered, that is such an inspiration to others. Thank you so much. One other question that I have is that you did say that you've noticed some subtle symptoms. Um, can you explain? Because I'm glad you mentioned that, because there are some patients like who do notice that, and then they see there's something wrong, but then they also think, oh, there's nothing wrong, and they just ignore it and they move on until they get really, really, really sick, and that's when they come to the emergency room. Can you just explain what are the subtle symptoms that you have felt? Because as you know, for kidney disease, there are no symptoms. And when you do have symptoms, you develop those symptoms when you're in that advanced stage of kidney disease. So I like to kind of have you share that, please.
Okay. Well, obviously the eyes, that's not one that was that was easily ignored, because I was really I wanted that to be so surface. I was so
Mm-hmm.
get my eyes checked at that point when I started seeing the halos and floaters and things like that. But because of the knowledge that I knew from growing up was such tight, like being really on top, my mother was my biggest advocate. I knew that that was back of the eye. and I was afraid, couldn't ignore that. But some of the other subtle things, I used to blame it on wearing heels all the time, but I was having some neuropathy.
Mm.
Oh, it's just the shoes. Maybe I was actually experiencing neuropathy.
Mm.
I had some gastrointestinal, gastro things happening that I was just like, oh, maybe it's what I ate.
Mm-hmm.
And it was actually a concern
Mm-hmm.
that I found out. So even down to always feeling nauseated, but thinking it was what I ate, or maybe it was a sugar that was affecting it. These were things, when you think you have acid reflux or
Right.
allergy or something to, it wasn't. Sorry. So allergy to food. And it wasn't, like I said, the eyes I couldn't ignore. It was very I went to my childhood doctor who didn't even specialize in retinopathy or anything like that. He was actually more of an optometrist, but that was my fear. I said, let me go to somebody that loves me and cares about me. And when he even looked at this, he said, we need to see a specialist. And that first appointment, which happened about 2 weeks after that, it was already time for surgery. I didn't even another doctor. We went from the second suggestion. They saw the back of the eye. They said, matter of fact, don't eat anything today. It was 10 o'clock in the morning. Don't eat another thing. You're on your way to surgery. And I was like, what is happening? And there was a point where I thought that I was going to lose my vision. So,
Oh, wow. Oh, okay.
Yeah. Some of the gastro things and definitely neuropathy.
Okay.
Yeah.
Okay. And you did mention nausea too.
And nausea as well. Yeah.
Nausea. And how was your appetite? Did you see any changes in your appetite?
My weight fluctuated over the years. At one point, the diabetes, when that A1C was high, I I think even at one point, even I was kind of insensitive. Maybe one of the jokes was like I was a bobblehead. I was very thin, and then sometimes I would put some more weight on. So I saw fluctuations of weight, and it wasn't necessarily that I was eating more or less at these times. As well, that was a sign of control. Yeah.
Okay. I know you had talked about the transplant process, like how it was kind of long and but then you also told me it just happened really fast. Like I didn't wait for that long. So could you just explain that a little bit?
When you get listed, I think there's something Leah may understand this. Well, maybe no, she was you were young too. But you know what? You think I'll be waiting forever. And it was something about one of the nurses told me, now that you're getting that pancreas, it's probably going to happen soon. But I never felt like I had a chance to process. First of all, it was my first surgery of my life at 40 years old. I had never had a surgery.
Wow. Yeah.
Years. I think God did it in the way that it was supposed to happen for me. If I had too much time to think about that, out of it. I wasn't doing bad on dialysis, even though I knew I didn't want to stay on it forever, but never had a chance to process. And I actually had more than one call within 2 months. They came week after week. It was very interesting. So the first one, the pancreas wasn't viable, but the kidney was good. The second one, this is so funny, and they happen so randomly. They really do. This is happening at like 7 in the morning or 3 o'clock in the afternoon. The next one was the inmate. Hey, you guys might laugh now, but I didn't want it. And I didn't say no. I was like, no, what's happening? Because he was high risk. There was a risk of hepatitis, but now that they can treat hepatitis, and I said, no. I have enough going on, eyes, everything else. I didn't want it. And I was afraid. And the person on the other line said, don't be afraid to say no. And I thought that I was going to miss an opportunity or something, that they wouldn't call me again. And he told me, it's okay. You can say no, you can decline. And I knew that wasn't mine. Those were not my organs. About 2 weeks later, I did get the phone call. And the initial phone call that you get is, hey, we have some organs that came in. Are you in Chicago? Can you? The surgeons are looking at it. And if they're viable, I'm going to give you a buzz back. And that 2-hour window of when they call you back is, I just I was anxious. I had to call my doctor. He was excited and I started crying. He was like, "Are you having an anxiety attack?" I said, "I don't think I'm not ready. It's only been 2 months of being listed.
Yeah.
Like, I don't want this yet."
Yeah.
But they were viable and I was in surgery. So
Yeah. Yeah, I think there are a couple of stories that, not stories, like these are from real patients that I've heard. Like one of my patients got it like within a month. And I think you're my second person that I'm hearing like within 2 months. And that is also an inspiration for others who are kind of waiting in line, and waiting to hear that word, and that's awesome because in Illinois, the wait time is a little bit long, like five years at least. But the fact that you've got listed and then got called, that's awesome. That's that's really an encouragement for others, especially who are being listed and just kind of waiting for that call. Thank you so much for that story. I am gonna kind of go around, so I'm sure I'm gonna come back to you. My This question goes to Leah, or Leah, I'm sorry. I know that you're a two-time kidney transplant recipient. Um, the can I just ask, like, when you had the transplant failure the first time and then when you had to do the second transplant, like how did you react to that? Like, um, did you have any problems, like as far as wait time and getting the transplant, and and how did you experience this, like with your personal experience, how did you overcome these challenges, especially after the first failure?
Yeah, I think that's a great question. I think the fact that the first failure happened so quickly was a bit of a blessing, in retrospect, because I didn't know how sick I had been until I had the transplant. But two, I didn't have a chance to really like adjust my life. You talk about like Deja, you talked about like you've lived with this your whole life. And so it's this piece of you. I didn't have a chance to like adjust my identity from being a dialysis patient to now I'm a transplant patient and recipient, and what does that mean? So I think there was a little bit of a blessing in that short period. It took another 13 months for my second call. The first time I was listed and I waited about 16 months for the
Okay.
first call, and about 13 months in between the second ones. And I'll be honest, I was so tired, and just so sort of like a little bit apathetic with the second call, that I wasn't convinced that anything was going to be different. So I was like, yeah, I'll go. Yes, we'll do this. But it just, I didn't let my mind catch up quite yet, because I think in the back of my mind, it was still a matter of, okay, but if this fails, then what do I do? I definitely experienced some challenges after the second one. About 3 months after, I experienced some moderate rejection, and had to be hospitalized again to manage some of the rejection scenarios or rejection symptoms and things. And I've since had subsequent health issues as a result of both the high dose steroids from that and just some not great dialysis. But honestly, the hardest part was the mental part in catching up. My body eventually got there. But that mental part wrapping around like, okay, who am I now? What does that mean in terms of how I need to navigate the world? What do I need to think about or not think about, eat or not eat? How do I explain this, or what considerations do I have now having gotten the transplant versus being on dialysis when it comes to medications or other things? It is a much bigger sort of mental experience, or at least for me, than I think I was prepared for. And so as I think back on it in retrospect, I had great like physical health care providers. I wish that much earlier I would have. So let me give an asterisk to this. I am a social worker by training, so I am the worst therapy client in the world because I think I know everything. But I will say I wish that I much earlier had found mental health support
Okay.
for myself, and good mental health support, because the
Yeah.
mental aspect of this
Yeah.
is, whether you have kidney disease, whether you're dealing with whatever it is crucial. I would also say I wish that I had found that more for my family and the people that were supporting me.
Mm.
Because just like in other scenarios where like you're sick or you're dealing with something, like it happened to me, but it happened for my nuclear family.
Yeah.
And they needed that kind of support in a different, their own kind of support in a different way. So I want to add that because I think that's crucial. I don't know if we have caregivers on the call,
Yeah.
but everybody sort of needs that piece of it as
Yeah.
well.
And you brought a great point, Leah. I really appreciated that you made that statement, taking care of your mental health, because even as providers, as physicians, when we do advise our patients, do this, do that, do this, it's like very scripted, right? You as a patient, you're coming in and you're taking in all this information, and it's your responsibility to make sure that you follow those instructions or recommendations. But, at some point, you as a patient have to be ready to take that in. And like mentally, I mean, you have to be ready. A lot of times you do know that this is happening to me. I know that I have kidney disease. I know that I need to go on dialysis soon. But it's like, how well are you mentally, like to accept this reality that this is happening, right? So the earlier that you do seek help, and even with, the support that you get from your family, take all that in as much as you can. Even if you need to go for counseling or therapy or anything that's going to help you to move forward this process, that is a plus. I'm so glad you mentioned that, and I appreciate that, and you are helping others, and I just wanted to let you know that.
I appreciate that.
Deja, do you have any recommendation as to, like you've had diabetes for such a very long time, and what is your recommendation as to like making sure, like how to manage this illness, this chronic illness, and also to prevent the progression of the illness, to prevent the progression of the diabetes and the CKD or the kidney disease? Could you share your experience, please?
Oh, wow. That's a great question. Take it seriously. Take your health serious. Take it serious and make it a priority. I think building relationships, if you don't know how to advocate for yourself, bring somebody with you. Sometimes when you're receiving information, it's not always good news. It's not a praise report. Sometimes we turn off and we stop listening because we're emotional. We are absorbing
Right.
the diagnosis, and we're no longer even listening. So it's okay to take notes. It's okay to ask your provider if you can record it if you need to go back on something. It's also okay to make notes in your phone so you don't forget to ask. Use your MyChart, call. I think make your health a part of your self-care. If you have time to get the coffee, get the nails, do all the stuff, your health is your wealth.
That's great.
It really is. Take it seriously. And because I had it so young, some of the things I was just I had really good health care, and I had a really great start. So by the time some of the little things were happening, I always felt like I had more time. Like, you know what? I haven't been on top of it. I'll get to it. I'm going to find a provider. I'll do it. I mean, even that, the matter of months of me just getting a Dexcom and getting an insulin pump took me from 11 to 7. Why didn't I do it a year before? Why didn't I do it? And obviously there's some disparities, insurance and other things, but why didn't I get the resources I needed? You can do it with no money. You can find the resources to get the health care and things that you need, but you have to start advocating and you have to speak up. And I think having honest relationships with your providers is where it's at, because it is really teamwork. It is a team experience. My doctor, she just doesn't sit there and rattle off all this stuff. I'm telling her how I feel on the medicine. I tell her how it makes me feel. I also during PD I had burnout. I had a burnout moment. I just feel like the more honest you are, it's okay. You can tell the truth. They could see it in your numbers anyway.
Right.
No need to act like a perfect person. They look at your numbers and you're sitting there BSing about like, oh, and I've been doing this. And they're like, well, why is your A1C 11? You're taking all the insulin. That doesn't make sense. So sometimes we get caught up in what it looks like. The doctors have really seen it all. Be honest.
Yeah.
Be honest.
Now, I do have a couple of questions in the chat box that I would like to ask. This is from our audience. Can any of you tell me how to prepare physically before transplant? I think this question goes to either Leah or Deja.
Deja, you wanna?
How to prepare? You know what? I didn't have a lot of people that I had to. I mean, I knew people that had kidney transplants, but nobody with a pancreas. And that is why I'm advocating today. There are a couple things I can't tell you, like answer it that way, but what I can say, there are some things that the doctors don't say about getting a pancreas. I haven't held this much weight in a while. There's a weight gain, and then there's the fear of getting type 2 diabetes from gaining weight. I think, like Leah hinted on earlier, I think a lot of people also go into this thinking it's a cure.
Mm-hmm.
And if you can't do the work while you are on dialysis, this is not what you want. You really don't. This is not over for me and Leah. Every time we go to get those biopsies and do all of that, the work is consistent. I still give lab work every 2 weeks. But that I'm not saying this to discourage you, because what it did do is it gave me freedom. It released me from dialysis. I can go on vacation. I can take the baths. I can swim in the ocean again.
Mm-hmm.
And I love the freedom that it has allowed me. But I live a very compliant life.
Mm-hmm.
The things I did before, I don't miss medicine. I don't have room for those types of mistakes.
Yeah.
So it's a compliant lifestyle.
Yeah, because you brought a good point, because at the end, you are in charge of your health, and that it has to come from you. So thank you so much. I we're gonna wrap up pretty soon, but I do wanted to state that kidney disease, it is a silent disease, and as we have heard from the panelists today, that a lot of times you don't have any symptoms. So one of the important things that you have to do is making sure of addressing the risk factors. So one of the causes of the kidney disease is diabetes. That's the number one cause. And number two is high blood pressure. The other risk factors are age over 60 years of age, ethnicity, Latinos and Blacks, they are more at risk of kidney disease. If you have family history of diseases such as Alport, IgA nephropathy, and polycystic kidney disease, then you have to have a discussion with your family and take that discussion to your physician. Get those things taken care of ahead of time. And that management is so important early in the disease so that you can delay the progression of the disease. Thank you so much for Nadia. She shared a lot about like how she's able to stay in that stage 3 disease for such a very long time. And it takes a lot of work from that individual, and she's proved it. And she was even able to get off of insulin for 2 years now, and that's awesome. And it's inspiring. And thank you so much. And I really appreciate that you guys coming in and sharing your personal stories. Thank you to everyone who participated. And I also wanted to remind everyone that you are more than welcome to reach out to our panelists if you have any further questions, and they're more happy to share if you do have any such questions. I'm going to turn it over to Rachel, who's going to close out the session.
So thank you all so much for joining and for just such a wonderful discussion. I'm wondering, as we close out, if each of our panelists might want to just offer one final piece of advice to our audience on how you stay healthy and what you might recommend for prevention. So I'll turn it over to Nadia first.
The best way to stay healthy and to prevent kidney disease is to watch your numbers. Watch your diabetic numbers, your blood pressure, and definitely watch your creatinine numbers.
Thanks so much, Nadia. How about you, Leah?
I think, two things I would encourage the same thing that Nadia mentioned, like stay aware of what is happening for you. And also remember that every day is a new day. Don't beat yourself up if you trip over a bad diet in one day and you need to start the new day again. Every day is a new day and a chance to prioritize your health and wellness.
Thank you so much. And Deja.
I would say that your mind controls your health. How you think is a big factor in that. And as you can see from each of us, it's not a death sentence. You can manage before you need a transplant or anything. You can manage it. It's manageable. It's not a death sentence. So
Yeah.
keep
Thank
fighting.
you all.
All my warriors, keep fighting. Kidney injuries.
Thank you all so, so much. I know we're kind of at the top of the hour. I'm just going to share. So I know a couple of our panelists have shared just how to kind of stay connected with them. So I'm going to pop that up really quick. And I'm just going to say thank you so much to Anita for moderating. And thank you so much, Nadia, Leah, and Deja, just for sharing your stories and being so inspirational to our audience today. Hope everybody has a great rest of their day. Thank you all again.
Thank you. Bye-bye.
All right.
Bye.
Bye.
Thank you.